So this is a screencast for Health Sciences 510. It's Module 3, and it's a presentation that I've titled Access to Healthcare Services for Those Who Are Between Jobs. This assignment is by William J. Baldwin, and full disclosure, I do not have any conflicts of interest. I do not have any investments that are affected one way or the other by the policies or proposals that I'm presenting here today. I am going to skip over the abstract and save that as my summary, and I'll just get straight into it. My first 3 points, that there are those out there with private employer-provided health care with affordable premiums and quality benefits. If this describes you, then that's great and bully for you. But there are also persons in career fields that come with discrimination and or people who just aren't very good at keeping jobs, and this results in frequent periods of unemployment. While on unemployment, obviously, you're not getting employer-provided premiums or employer-provided health care of any kind. Other career fields, due to the nature of the industry, such as construction or the oil industry, are subject to boom and bust cycles of hiring and then massive layoffs without any notice. The great benefits, they stop immediately, paid premiums are gone, and they no longer apply to a yearly maximum or derive any benefit of any kind. And until passage of the Affordable Care Act, which some people call Obamacare, any conditions diagnosed under the previous insurance could also no longer be covered by any insurance ever. Going to the next slide. Although the Affordable Care Act or Obamacare, whatever, eliminated the pre-existing condition abuses of private insurance, and it did increase access for the working poor, the disabled, and other populations, the unemployed and those between jobs who are on unemployment insurance still have no health care benefits other than the local emergency room. A catastrophic diagnosis or a major accident could easily result in financial ruin. The media, such as CNN and others, have presented numerous cases of persons that were self-employed, they were well off financially, or they were, until eventually being diagnosed with a catastrophic illness. The story usually follows the template of selling the house, then the car, after draining all your savings, and now the poor guy's wandering homeless on the street somewhere. It should also be noted that more than 60% of people who go bankrupt are actually capsized by medical bills. And I'll go to the next slide on that note. Now, if the middle-class educated homeowner or even wealthy business owners are only one illness away from financial ruin, what chance do the unemployed have? Even with unemployment insurance, such persons are making half pay and paying the same bills they struggled with at full pay. For this reason, and reasons of simple fairness, unemployment insurance should begin paying the complete or at least the employer portion of the previous health insurance premiums that the recently terminated ones had. Now, such payments, they could be within COBRA, they could be within ACA, or they could be part of a repeal and replace package. This would close a glaring exception in universal health care and focus on the mental well-being of those who are under extreme stress, which also might well be beneficial to innocent persons around them. I don't want to go too far into that. Now, at this point, I'm going to make an appeal to those in the target audience for those who are between jobs. Any legislatures, executives, and support staff at the state level, I have those included because unemployment insurance is usually administered by state governments. But I also want to appeal to legislatures, executives, and support staff at the federal level. Although unemployment insurance is usually administered by state governments have less resources to pay for new programs, whether they're justified or not, and are usually looking to be more business-friendly than all of their neighboring states. And a state doesn't project a business-friendly environment by siding with the workers instead of with the business organizations. And also, they want to be business-friendly by not passing more and more even justified programs at the expense of the business organizations. State governments are also more likely to have the anti-welfare queen attitude at their level, despite the fact that workers pay for unemployment insurance with their own involuntary payroll deductions. And that attitude does still exist. Going into my summary, although the Affordable Care Act did increase access for many populations of the working poor, the disabled, and etc., those who are between jobs and are on unemployment insurance still have no health care benefits other than the local emergency room. A catastrophic diagnosis or a major accident could easily result in financial ruin. And of course, 60% of people who go bankrupt, they actually go bankrupt because of that. For these reasons and reasons of simple fairness, unemployment insurance should begin paying the complete or at least employer portion of the previous health insurance premiums that the recently terminated ones had. And again, such payments could be within COBRA, it could be within the ACA guidelines and revisions, or it could be part of a repeal and replace package. And that does conclude my presentation.